There are 3 clinical psychologists employed at the Health Authority, 2 for children and adolescents, 1 for the adult population. There is funding for 2 further psychologists within the mental health services, but these posts are currently vacant. The GHA provided this information in response to GBC questions, the answers to some of which aired on last week's Viewpoint. The GHA claims it is actively working to fill these positions and that the recruitment and retention of clinical psychologists and medical professionals in general is an international issue. The authority points out it employs other mental health professionals and that 5 staff offer 125 hours of counselling services a week in addition to the clinical psychologists. A number of other statistics were also provided by the GHA regarding referrals, close to 2/3 of which are female, with males making up just under 36% of patient referrals. We also have a breakdown according to age demographics. 24% of referrals are aged 35 to 44, 22.8% aged 25 to 34, with 17.9% aged between 16 and 24, a combined total of 64.7%. Nearly 2/3 of those seeking counselling and therapy through the GHA are between the ages of 16 and 44, suggesting a far smaller proportion amongst those outside this age bracket. The GHA said the average number of referrals per month is 40, although this spiked to 60 between September and October last year. Of these referrals, we were told 27.5% decline an initial assessment, patients who said they do not need or want the service for whatever reason. The remaining 72.5% require counselling or therapy, but the GHA points out 22.5% of these do not attend, which increases the strain on the services available. GBC was told 22 patients are currently awaiting a counselling appointment. We are currently awaiting further clarification on what time frame these statistics correspond to. The GHA says it is working to strengthen clinical leadership for all staff in psychology and counselling services in order to stabilise the workforce, and said where there are changes in staff teams, these will be announced as they are finalised.